a few other people hop on, but I want to be respectful of the time, especially with our two very, very busy speakers. And I want to welcome you to another session of Doug and a Doc. I appreciate you taking your lunch hour to do this, and don't be shy at all about eating lunch in front of us. We know that this is the right time of day. So once again, we have Doug Cropper. Doug is going to offer us a system update, kind of a state of the system. And then he's going to kick it over to Dr. Kurt Andersen. We had Dr. Andersen on a couple of months ago, or even maybe it's been several months ago, when we started the COVID journey and we started offering these programs. And I would have thought by now we wouldn't have Dr. Kurt Andersen talking about this again, but we are. We're in a different part of the journey, but we're still talking about it. So I would encourage all of you to ask questions. You can certainly, if you're a little bit shy, just put them in the chat box and I'll make sure that they get asked. And I will turn it over to Doug and thank him for his time.
Thank you, Missy, and thank you all for being on this call. It's always great to see all of you and stay connected, especially during this challenging time. It's nice to see the weather today and that we're moving into spring. I'm going to give a very brief pandemic update since that's going to be the main focus of our time together, and Dr. Andersen will talk about that. And then I'll talk about some of the good things that are happening at Genesis that you may or may not know about. So we're in essentially our 15th month. Well, we're 14th month, but we're moving toward our 15th month. Quite a journey in relationship to this COVID-19 pandemic. You know, the peak of our inpatients, we kind of measure COVID based on a few indicators. One of them is census. The peak was around 150 patients in the hospital with just COVID-19. That's a big number. Today we had 24. We have recently been hovering between 20 and 30. A few weeks ago, we got up to as high as 50 again. I was very concerned at that point that things were going the wrong way, but things have improved a little bit since then. We also watch our 7-day positivity rate, so how much testing is done and how many of those people are positive, and it's 6.32 today. Anytime it's below 10 is good, below 5 is even better, so that's going a good direction. We got as high as maybe 12 to 13 within the last month or so, but the high was in November when we saw our just unbelievable surge, and we were above 30. So that means, you know, a third of the people that were tested as being symptomatic were actually positive, which is a hugely high rate as opposed to 6.32 today. One of the big things that we're seeing is a major shift in age. Well, you'd expect that amongst the infections because 70+% of the older population has been vaccinated. In fact, I would say most of you on the call have been vaccinated now. So who's getting sick? Well, it's the younger population that's unvaccinated, and it's also some of the older population that hasn't taken the vaccine. I don't have updated data, so I'm going to give you some older data that you might find interesting, and that is that if you look from April 11th, I'll get this update on Monday for this week. If you look from April 11th to back to the first day that we vaccinated anybody in our market, that was December 15th. So from December 15th to April 11th, about 529, actually 529 people were admitted to the hospital. So those are the sickest people at Genesis. 529 people admitted to the hospital. How many of those people had been fully vaccinated? What do you think? The answer is 0. So far, the vaccine has been 100% effective in doing what it's supposed to do in our market from a Genesis standpoint, and that is avoid severe illness and avoid hospitalization. So that's a testimonial to anybody that's saying, well, should I get vaccinated or not? I was at the gas station a couple of days ago. I'm a poster child, and I market the vaccine wherever I go. I asked my friends at the gas station, there's probably 20 people there. I said, have you guys been vaccinated? And they said, no, we don't want to turn into zombies. I said, well, do I look like a zombie? I was one of the first people that are vaccinated, and I gave them some statistics, and I said, you guys need to get vaccinated. You know, the incidence of complications, Dr. Andersen will talk about that, are very, very low. Now, I will say that this has been a hard year for healthcare employees. If you go up to our units, our ICUs, Silvis and Davenport, or our medical units, Silvis and Davenport, very difficult. These nurses and doctors have been taking care of people, like I say, for almost 14, 15 months, very difficult. I was very pleased to see that I was notified today that 5 of the 10 nurses that are going to be recognized by the Quad City Times were Genesis nurses. And so that's a real great thing. Genesis nurses deserve a lot of accolades, as do all nurses and doctors in the country. Let's shift gears before I turn it over to Dr. Andersen. Good things at Genesis. Number one, we're doing well financially. We're holding our own. It's a break-even year in a very difficult year for healthcare systems. Last year, the revenue loss when we started to wind down hospitals, which was about this time, about 12 months ago in April and May, our revenue loss was $42 million. $42 million. So to be essentially break even with that financial hit, is a very good deal. From a patient experience standpoint, we've never had higher patient experience at Genesis than we do now. A couple of years ago, we were about at the 40th percentile. No one was happy with that on the board. We are running right now about the 63rd percentile. We measure our patient experience at about 250 sites of service across Genesis. So it's not only our inpatients and not only our physician clinics, but everywhere there's patient care delivery. So the average is the 63rd percentile. So with Dr. Andersen on this call, who do you think leads the system in outstanding patient experience? What part of our business? It is the physician services. Patients love Genesis doctors. We are like 95th or 98th percentile with the doctors. So very, very high patient experience with the doctors. Jackson County, a hospital we managed to the north, was just moved into a brand new facility. If you ever are driving on Highway 61, look for it. It's right off the road there. Beautiful. That hospital was 60 to 80 years old, parts of it. It needed to be replaced, and that's a beautiful thing that happened. A year ago this time, we were notified that we were a top 15 health system. That's a big deal. There's almost 300 health systems in the country. To be top 5 in our category or top 15 in the country is a really big deal. That should be coming out soon. So watch for that again to see if we repeat. It's one thing to win that once. It's another thing to win it twice. And we'll see what happens. We should know that within the next couple of weeks. Speaking of awards, GMC Davenport was recognized a few months ago as one of the best maternity hospitals in the United States, the only one in Iowa recognized. We've done a lot of things in the foundation to strengthen our maternity program. Recently, the grief room. And we have a very, very strong OBGYN service. And so that's quite an accomplishment to be the only hospital in Iowa recognized nationally for maternity care. We've done a lot of clinical development. Recently, the latest thing in orthopedics is robots. We have one at both Davenport and Silvis for total joints. So more and more physicians will be using the robot to be excellent and accurate in their total joint replacement. Wesley Life is an organization we have a joint venture with. It's called WellSpire. We spun off all of our senior care services into that joint venture. And we are building 2 senior campuses. You probably know about this, but I wanted to talk about it briefly. One is the Summit in Bettendorf. It's almost done. It'll be done and being occupied in October or the fall of this year. The next is called Fieldstone. That's in DeWitt. We're moving dirt right now, and there's going to be a groundbreaking in the next couple of weeks at Fieldstone. We're very happy about our partnership with Wesley Life. They are an excellent senior services company and have strengthened what we can do in the market there. All of our new communities have both senior housing, assisted living, and skilled nursing beds. Many of them have also memory care units. It's a very good thing for the community. I would mention, in addition to GMC Davenport as a maternity hospital, we continue to receive clinical awards. We were recently recognized for our stroke program by the American Stroke Association at the highest level, which is gold. And we're in the midst of presenting to the board on May 1 a 5 to 10-year strategic and facility plans. So we've done a lot of recent facility planning and strategic planning within the last year. So even though it's been a pandemic year, it's been a very good year at Genesis. We continue to do better and better clinically and become stronger and stronger. And so good things are happening even with all of our pandemic challenges. And feel free to ask me questions later. With that, I'm going to turn it over to Dr. Andersen, who's going to talk a little bit more about COVID and about vaccines.
Thank you, Doug. I think you did a nice job of reviewing the overall health system status on COVID patients. I'm going to talk a little bit more around the vaccination effort. If you recall, we started our vaccination effort with our healthcare workers, the employees and the frontline healthcare workers, including physicians, nurses, and all of our support staff. We then moved on to the over 65 population being the focus area for our vaccination efforts. And then now we're into the general community, anyone over 16 for the Pfizer vaccine. So it's amazing over the period of weeks how things have changed. You know, we started off with not nearly enough vaccine for the number of patients who we wanted to get the vaccine to. And over the last few weeks, we're now in a position where we actually have more vaccine than we have people who are asking for the vaccination. So we're getting a good supply of vaccine in Iowa on a weekly basis. We're getting anywhere from, 2,300 to 3,500 doses. And this week, we're probably only going to be able to administer a little over 1,000 based on the lack of sign up from the public for the available slots. So we're having to reconfigure our approach. We've done a lot of work with our marketing communication team to get the word out that we have vaccine available. We've set up a couple different mechanisms to make sure that we can easily schedule vaccinations, both for our patients through the patient portal and through the general community through a scheduling application that we went live with a little over a week ago. And so the process is pretty easy to sign up. So now we just got to keep trying to get the word out, and we're starting to do more and more outreach with community groups, offering them some walk-in times or some preferred scheduling time. And we had a discussion yesterday, and we'll continue this discussion with some of the health system leadership about where we go next. I think as we look in the weeks ahead, we will continue outreach. Maybe we'll be doing some mobile vaccination sites, and then we'll be transitioning to providing the vaccine in some of our clinics. It is challenging logistically, and it does create some safety and quality control issues. These vaccines that we use, we predominantly use Pfizer. We do occasionally have some Moderna, but they're both the mRNA type vaccines, and they have a relatively sensitive lipid envelope that encapsulates the vaccine and allows it to be brought into the cells where it can become effective. And you have to process those very carefully, and they have a short shelf life once you mix them and thaw them. And so I'm a little anxious about how we're going to do that and maintain the quality that we've maintained in our mass vaccination site. But I have a lot of confidence in our operations team and in our amazing pharmacy and nursing and support staff. So we'll begin that process over the next week or two, and likely move into a more traditional vaccination mode with less mass vaccination going forward. So that's kind of a major transition that's going on. It's a little surprising that we got to where we are as quickly as we did. I thought we'd still be heavily involved in community vaccinations at the mass vaccine clinic into at least early summer. That was my original thought, but it's been very different than that. Part of it is that we've gotten a lot of other community partners like the pharmacies and the health department offering vaccinations, which is good. It doesn't matter where you get it. We just want everyone to get the vaccine. And part of it is we haven't gotten the community demand for vaccine that we thought we would. And so we've got some work to do there as a community to get vaccination levels higher. So I don't know that I have a whole lot more to add on COVID clinically. You know, our set of tools remains relatively the same to take care of patients with COVID. For the most part, it continues to be supportive care. We do use steroids, and we have used the antiviral drug remdesivir with some beneficial effects. We do still offer the polyclonal antibody therapy on an outpatient basis for patients who are at high risk of complications and have COVID. And that treatment has been shown to be up to 70% effective at preventing hospitalization in those patients. But even that has been surprising, the lack of interest amongst patients that we've offered it to. So we still got a lot of work to do with educating the community and getting them to have maybe a little more trust in the healthcare systems. Not sure. We've had just a challenging year, I think, with just trust and working together as a community and nationally. So we're fighting some of that still. I think that's kind of where I'd leave it, and then maybe open it to the questions more.
Dr. Andersen, I want to skip back to vaccine hesitancy and some of the myths around vaccine, but I had a quick question for you. In terms of long haulers, we've all heard about those patients who do recover to some extent from the virus, but then they're suffering many setbacks and symptoms. And I'm wondering if you're hearing that through our medical practices, and what are the options for those patients?
Yeah, we do have some of those patients that follow our primary care physicians are managing some of them based on their symptoms. Dr. Motwani, our infectious disease specialist, has been involved in that, and certainly our pulmonary doctors are seeing some of those patients who are having ongoing respiratory function challenges. And yeah, it's not, for many of the patients that have severe COVID, it's not just a temporary condition. It has an impact on their life that goes on beyond the time that they spent in the hospital.
Are there any studies nearby or research projects for these people to be involved in that you know of?
I'm not currently aware of any research project or studies. The University of Iowa has been putting together a COVID kind of follow-up care plan, and so I don't know that there's a research component related to that I've seen, at least with the university hasn't reached out to us with that. But I would not be surprised if those do pop up over the spring and into the summer.
Thank you. And with regard to vaccine, I know that we're hearing that every adult will have vaccine by the end of May, and by the end of July, we can expect every American to at least have had the opportunity. Dr. Andersen, you've been practicing for a while, or you've been in healthcare for a while. I won't ask you how long, but isn't this just normal for vaccines? Isn't there always a hesitancy?
Yeah, I think there is, especially with the new vaccine. There's a period of uptake, and people have to develop kind of a sense of confidence and trust in the vaccine. The one that's a little bit surprising about this particular vaccine is that the efficacy and the safety are both so favorable that it surprises me that we wouldn't see more people wanting to receive the vaccine. I think you face, in some populations, it's just the thought that, well, if I get COVID, I'll be fine, which may very well be true for the majority of otherwise healthy people, especially younger people. The problem is you're going to continue to spread the virus, which is causing so much challenge across our, communities and across our activities that we all want to get back to. So it allows, the more people that are unvaccinated, the more it allows the virus to continue to spread and continue to be a limiting factor in our lives. And so with a safe and even at that, we still have patients who appear that they should do well. They're not that old. They don't have that many complications with their health overall, and they get COVID and they have a very rough course, and they don't do very well. So although I understand it, it's still frustrating, because the reality is that every patient that we hospitalize going forward potentially could have been not hospitalized, because the vaccination could have prevented the severity of disease that results in hospitalization, and certainly death. So I think we've got some work to do, and I would agree there is hesitancy with vaccine. Every year we have to work to get our flu vaccination numbers, 50, 60%, 70% in certain populations, and it's a challenge. Part of it too is, normally we have a more clinic, primary care based vaccination strategy, and you can get the vaccine in the community or you can get it at your physician's office. With this vaccine and the scarcity and the way that it has to be handled, we haven't been able to use our normal mechanisms, and we've taken away some of that one-on-one conversation with the physician that they trust. And I'm hopeful that we're going to work through the logistics now that the supply is available to get the vaccinations into the clinic settings where patients who may have had some hesitancy will have a chance to talk to the physician that they trust and get the vaccine.
Good point. We've had a question. Are those that have had and recovered from COVID-19 still expected to get or need to get the vaccine?
Yes, we don't know how long the natural immunity will last. We know that there's a significant boost in the immunity that you get both in antibody levels and in some of the memory infection fighting cells that are in our body. So if you've had COVID and recovered, you likely were protected for a window of time, but that window will close and you can be reinfected. We know patients have recovered and then been reinfected after 3 months or more from their first infection. So the booster dose, the boosting of immunity, I should say, through vaccination is absolutely recommended for COVID recovered patients.
Let's talk about a few myths. We'll do rapid fire, okay? Myth 1, the vaccine was rushed and it isn't safe.
Well, I think it's amazing that they were able to get the vaccine out in the timeline that they did, but the technology that they used, that we used for the mRNA-based vaccines has been around for more than 20 years. So a lot of this research and development was already there. They were just able to use it to apply that technology to this vaccine. So I think it's, it isn't like we invented some completely new thing in that amount of time. We refined some manufacturing techniques, used some old, long been studied research to get the vaccine out quickly. And they went through the normal testing process, and the FDA is stringent, and the follow-up post release of the vaccines has also been stringent. I think the recent hold on the Johnson & Johnson vaccine was really a testimony to the fact that the monitoring for adverse events works. I mean, they detected an adverse event that was happening in less than 1 in a million, and were able to put a pause on the vaccine until they could study it and we can understand it better. So that tells me that, our monitoring system is working the way we want it to. And when we look at Moderna and Pfizer, we're, in the tens of millions of those vaccines being administered without a concern of any significant safety coming forward. So I think we're in a very good place with safety. I don't feel the vaccines were rushed. I don't think that they were approved. A lot of people get caught up in the fact that, well, they were approved for emergency use and not for standard FDA. Well, they follow the standard FDA process and they'll work through that. But the emergency authorization was to allow the vaccines to be able to be used because of all the safety data that showed that they were safe and effective. So I really, that argument doesn't make sense to me. Really, we should be using these vaccines. They are safe, they are effective.
Myth number 2, my DNA will change.
Not from an mRNA vaccine, it won't. The vaccine doesn't work that way. It never enters your nucleus, the part of your body where your DNA lives within the cell. The vaccine works in the cytoplasm of the cell, where basically that little piece of RNA gets converted into a protein and then released by the cell, and then your body develops antibodies to that protein, so that when you see that virus, you become infected, you have a rapid and efficient immune response. There is no mechanism for this vaccine to incorporate into the DNA. So that's kind of that is a myth.
Myth number 3, it's going to give you COVID.
It can't give you COVID. It's not COVID virus. It's a piece of protein, mRNA, the code that will tell your body to make the spike protein. It cannot make the virus. It's not the virus. It's not a live virus or even a weakened virus. So you cannot get COVID from the vaccine.
Myth number 4, women will become infertile if they are vaccinated.
Also not possible. Doesn't have any mechanism where it could affect the development of the embryo. So I'll rely on the experts. I mean, I'm a physician, but I'm I'm not a maternal fetal medicine specialist or obstetric specialist or researcher in those areas, and all of them have concluded that the vaccine has no impact on long-term or short-term pregnancy and fertility.
My last myth, and there have some truth to this perhaps, but if you get the vaccine, you will have severe side effects.
So I would say the common side effects, yes. Some achiness. Maybe some people have a low-grade fever the day after. So just feel tired. Certainly, fatigue has been a common post-vaccination symptom, and that can happen with first dose or second dose. But again, that happens with flu shots. That happens with shingles vaccines. It happens more commonly with shingles vaccine. If you compare the side effects of a flu shot and a shingles shot, COVID lies somewhere in between the COVID vaccine. It's probably closer to a flu shot. So it has mild to moderate side effects. All of them are limited. They can be controlled with just rest, time, fluid, Tylenol. And the severe side effects that we worried about, the anaphylactic reaction to a vaccine, have been very rare. We're still in that 1 in a million type event, and they really have not had a significant impact. There haven't been deaths associated with even that most severe reaction. So I think that we're well able to handle mild reactions that happen with a vaccine in the primary care clinic. The more acute reactions, we can handle those through urgent care. And in the rare event that there's an anaphylaxis, we can handle that through urgent care, the emergency room. And we just haven't seen that. We've had a few patients that had a more severe, what we'd call kind of an acute allergic reaction. It's not quite anaphylaxis, but it might have been a rash or hive-like concerning type reaction. And we've, on a few cases, administered their second dose in an urgent care or emergency room environment for safety, and we've had no problems. It's gone really, really well. So severe side effects are very uncommon. Mild to moderate side effects are a little more common than with a flu shot, but not by a lot.
Doug mentioned that he's the poster boy in terms of encouraging people to get their vaccine. I think a lot of people will be looking at the healthcare system as a leader in the community to know whether or not our employees will be mandated to get the vaccine. Other businesses in the community will have to wrestle with that decision as well. And I'm wondering if you can comment, or Doug could comment on what's the probability that this will become a required vaccination for our employee base.
Dr. Andersen can talk about that, and then I'll add on some stuff.
Sounds good. Well, so first of all, I'll say, hopefully the patients and the nursing staff look to the physicians to see what they think and what they're doing. And our physicians are the only group that has gotten a higher vaccination rate than our physicians is our administration. And so the physicians have led. We're like a 90% vaccination rate amongst our physician groups. And our medical executive teams at all of our medical centers have issued a unified statement encouraging all staff and patients to receive the COVID vaccine. So I think we're trying to lead by example as physicians. I think we've tried to encourage both our patients and our staff to get the vaccine for all the many reasons that I've talked about today. But at this point, we haven't mandated it. It is a new vaccine. We are trying to be sensitive to the fact that individuals may have their own personal concerns that they need to work through, but we've made ourselves available to answer their questions or concerns related to the vaccine. I think, I'll leave the hard part of this question to Doug at the end, but I think we have to think about the fact that our job is to take care of people in our healthcare system. And if we are not vaccinated, and we then have increased the chance that we can have COVID while we're caring for patients, I'm not sure we're fulfilling our mission by taking care of patients when you haven't been vaccinated and you have not done everything you could do to protect your patient.
So I'll just add to that. I will say that it's only a matter of time until we mandate. We mandate the flu vaccine, and we will mandate the COVID vaccine at some point. Right now, we're just under 70% of our employees have received the vaccine and are fully vaccinated. Somewhat of a disappointing number when I compare with other health systems. It's almost the identical number, unfortunately. People have reasons, and there is vaccine hesitancy. It's the demographic within the healthcare system are people like, I don't want to pick on them, but laundry workers, other support employees, for various reasons, don't want to get the vaccine. We have tried really, really hard. We continue to try, and we continue to inch up, but we are still hovering around that 70%. I was on a call with a small group of CEOs earlier this week with Andy Slavic. You may recognize Andy Slavic's number from Health and Human Services Administration. Andy's on the National Task Force. We asked Andy when the FDA, he's on the COVID task force, when the FDA would approve the vaccine or one of the vaccines and move it off emergency use authorization to regular FDA authorization. He said the first one will happen early this summer. I don't think that healthcare systems like us will mandate prior to that time. We won't mandate under emergency use authorization. We'll mandate under regular FDA approval, but it will happen. And it's just the right thing to do for the reasons that Dr. Andersen talked about. We've had 650 of our employees come down with COVID. 650, that's a lot of people. Now, the rates now are very, very low. There's 1 to 3 per day. Some days are 0 that are out sick. But at its peak, when we were surging, the number was huge. We had 150 plus out on one given day. We can afford to do that and not have and fulfill our mission. We have to be able to protect our employees so that we can protect and care for the community. So it will happen. It's just a matter of when. We'll probably take that through the medical executive committee process and through the board for final authorization. And the other thing I would say is Dr. Andersen talked about this, but I just want to emphasize it. All 4 of our medical executive committees, that's every single healthcare physician leader in the system, all 36 signed the resolution encouraging employees to get vaccinated.
That is encouraging. That's good news. I want to take a bit of a shift, unless there are other questions from our group as well. And please, don't be shy, those of you who are on the call. But I want to talk a little bit about behavioral health. And we obviously had problems in this area, behavioral health and substance abuse as a community before the pandemic ever started. The statistics I'm reading are getting kind of shocking in terms of the increase in people who are suffering mental health issues because of the pandemic, or attributed to. I don't know if it's in correlation with. And I'm wondering how our behavioral health program has been affected, or what we're doing in terms of collaboration with the community to address what could be an escalating crisis.
To answer, I don't know as much as you might think, but Jim Kohler, to answer that question, behavioral health, I think that's a big issue. This being isolated at home and not being able to do the normal things that you do, that has really cost my wife and I. And I'm very sincere about that. I've seen some big changes, and we're both able to come and go, and I can go to the store and wear my mask and all that. And I had my shots 7 weeks ago last Tuesday, and I had no of the side effects. And I would say also that Genesis has just had a super system. I mean, it was just great. Now, lots of people tell me they're not going to get shots and so on. I tell them, hey, don't worry about the vaccine, or worry about the virus, not the vaccine, as far as I'm concerned. But I will tell you that another friend of mine had this a year ago, May, almost a year now, and he was both put in a coma. He was put into had the oxygen and everything, was in the hospital 6 or 8 weeks, and finally did get out, is recovering, but he still is not back to work and can't go back to work at all now because of his COVID. Now that in itself is evidence that, boy, people ought to take a hard look at the thing. Then the other thing, my question to the doctor would be this: is could the vaccine be included with your flu shot mixed together in some way? And would that be something annually that he thinks is going to be a booster required?
Doug, do you want to
Dr.
do the behavioral health question first, and then I can talk about the booster vaccine question?
Well, the behavioral health question, obviously it's been a national issue. The rate of suicide is up. I can't remember the exact number. I think it's 4+ times, which is huge. I mean, the number of suicides that have occurred over the last year versus the normal rate of suicide. I think it's been difficult on everybody. It's not only a major inconvenience, it's just impacted our human interactions with each other. I think we're all doing the best we can with that, but it's taken what was an issue before and magnified it, created more problems. The inpatient unit, I would not say has been impacted dramatically. I think our outpatient services have gotten extremely busy. They were busy before. They've been severely taxed, and it's a challenging issue now. That goes to say that the whole behavioral health area is underfunded, under-reimbursed, under-designed, and has more demand than supply. That's a function of mostly the way it gets paid. And until that changes, we're going to continue to have a challenge in relationship to just the amount of services that are offered in any community. We're lucky in our community. We've worked with others, Vera French and others, to build that up, both in and outpatient services. In some communities, they've gone the exact opposite way that we've gone. They've actually closed services, decreased services rather than increased over the last 5 years. Would you add anything, Dr. Andersen, to that?
No, I would agree that I think we've built up our inpatient services and we've been able to meet the need. I can't remember the last time we had a discussion about having to transfer out of our community for inpatient care at Genesis. The outpatient has been a challenge in ramping that up. What we're finding now as we try to recruit and build up our outpatient team is that a lot of providers are migrating to online job opportunities for behavioral health services. So that's taking away the pool of applicants for us to a certain degree. And our own team has experienced that. We migrated to a lot of virtual care for behavioral health. And for the most part, that was satisfying to the providers and the patients when it came to a counseling visit. And that's something that's continued. So we're doing a large volume of remote care through our behavioral health program. But we're now competing with other providers outside of the community for remote care behavioral health, the talent pool.
Thank you both for that. I know it'll be a
Yeah, I'm sorry, I didn't cover Jim's question. The booster dose vaccine. So the COVID virus, like any virus, has had some mutations over time. We've heard about some of the variants, both UK, South African, Brazil, others. For the most part, we're seeing the good news we're seeing is the vaccines that we're using in the United States, the Pfizer and Moderna vaccines, have been able to remain effective and withstand any breakthrough infections high breakthrough infections related to variants. So we're holding ground with the current vaccine. We don't yet know how long the immunity will last with the vaccines. It certainly lasted as long as the trial groups that are out now. I think we're approaching 9 months. So we don't know the duration of how frequent you'll need a boost of your vaccination, but we do know that we will need to incorporate some variants into the booster doses, and the manufacturers are already working on that. I think Moderna already has theirs in trial. So I think that's a long answer to say I think it's likely there will be a booster. I don't know when the timing of that will be, if that will be as soon as this fall or as late as this time next year. And it may be something that coincides with the flu vaccine, but likely won't be combined in a single vaccine. I don't anticipate that happening, but it's possible. There are different types of vaccines right now, so it'd be a little hard to do that. The flu vaccine is either an attenuated or like an inactivated virus vaccine, much different than the mRNA vaccine. So I just don't think the storage, mixing, and all that would work. But the technology will certainly evolve with the vaccines, and it will become a more simplified process in going forward.
I have 2 questions, one left for Dr. Andersen and one left for Doug. And Doug, I'll give you yours first, but I'll have you answer second. I'd like to know, Doug, what you would tell this group to take out in the community if you have 2 to 3 bullet points so that every person in this call delivers the message from the poster boy, Doug Cropper, into the community. Dr. Andersen, my last question for you. Let's talk about what's safe. It's very confusing. I have been vaccinated. My mother's been vaccinated. Do we wear a mask? How many feet apart? Can we eat together? Can I go outside? Will I need a mask? What is considered safe right now?
Sure. Well, the first thing I think you have to remember is that even though these vaccines are highly effective at preventing hospitalization and death, and they're also very effective at preventing COVID infection, still somewhere around 5% of the patients that receive the vaccine, maybe a little higher, will still get COVID and will have symptoms. So it is possible that you can still get COVID when you're vaccinated. You can still spread COVID if you have symptoms if you're vaccinated. So those kind of precautions still have to be remembered and continued. Right now, we're still, although Doug mentioned the trend has gotten better with the 7% symptomatic rate of positive tests for COVID right now in our system. We still see a high amount of COVID activity in our community, especially in the younger population. Both teens and young adults, we're seeing they are the leading group when we're testing COVID that they're coming back positive. So the virus is still in our community. So what's safe? If you're in a small setting with, like in your home with other vaccinated family members, yep, that's safe. I think that's absolutely fine and appropriate, as long as nobody has any symptoms. If you are outside where you can distance, I think that's also safe to be outside and unmasked. If you're going to be in public settings, in the grocery store, in a restaurant, I think you need to be masked. And depending on your tolerance for risk of an infection, you have to think about whether you want to eat in a restaurant. That's an individual choice at this point. Now, my hope is, as we look a few weeks or months ahead, that our community infection rate will be much, much lower. In Israel, where they're a couple months ahead of us and have had a more robust vaccination effort, their infection rates, I believe the last one I saw was 0.3% of the patients are testing positive. 0.3%, not even 1. And their vaccination rate to achieve that was 58%. So they got 58% of their population vaccinated, and they've essentially eliminated the virus in their communities, and they're fully open. So if we can get there, then I think the overall need for masks in public settings will go away as well.
Thank you. Doug, you get to take it home.
What's your
advice? What are our marching orders?
I wrote an article for all the employees on Tuesday and stole the headline from a New York Times, or excuse me, as a Washington Post article. And the title was "The Most Dangerous Moment to be Unvaccinated." And so we're under a false sense of security in the United States because what's happening is the new variants are better at their job. They spread better. They're more deadly. Number two, the situation is getting better for those that are vaccinated and much worse for those who are unvaccinated. And it's only going to get worse politically because as things improve, as more people get vaccinated, the government will loosen restrictions and it will cause additional risk for those that are unvaccinated. So this is the most dangerous moment to be unvaccinated so far in the pandemic. With that point, number one. Number two, just do it, get vaccinated. That's point number two. It is within our sights to put this behind us. If you look at the trajectory for our community, if we continued as is up until this point, we would reach herd immunity, they predict, before July 1. The problem is, Dr. Andersen just told you, we're going to have 2,000 unused vaccine doses this week because supply is greater than demand. So as it slows down, it just pushes this issue out of when we'll reach herd immunity. So just do it, just get vaccinated. Last point, Genesis Health System is a top health system. When you measure us based on any of the national metrics, We are a top 15 health system. We're here to serve the community. We exist for the community good. That is our mission, and we're very grateful to be able to be here and serve.
And we're
Two.
grateful to you, Doug, and to Dr. Anderson for your time. We're grateful to every person on this call because you don't become a great healthcare system without the support of your community. So thank you for your contributions. And a special shout out to Bo Dexter, who's on this call today. He's a Genesis legend this year, a very high honor, and he has put together some clinics that have been getting rave reviews. So I wish you health. I wish you all that you could get out there and help us in our quest to get everyone vaccinated, and have a great day.